Well, Larry, after a very thorough examination by the staff here at Bond Street Malo Clinic, I find myself in this rather daunting chair. What's this all about?
Looks a bit daunting, doesn't it, Stephen? But this is actually one of the 3D X-ray machines. There are a number on the market, it's not the only one. This is one that's made in the United States. It basically is a machine where you're sitting upright. If you want to move back, I don't want to intimidate you too much, but then we lock you into position here with this little chin rest, and the machine then rotates around you. And what it does, after one complete rotation, it gives us a 3D representation of your skull. And we can actually organise whether we want to do the upper jaw, the lower jaw, or both. And then we're able to produce this screen here, which you can see is a representation which gives us the view of the maxillary sinuses, the nose area, the sinus on the other side, and by the way, here's a little bit of infection here. It enables us to see the nerve in the lower jaw. And the beauty about these 3D X-rays is that you see these films on the bottom, they are representations of 2mm cuts that actually pass from one edge right through. So we're able to see not only where the nerves are in the jaw, the sinuses are. We can see this tooth we're looking at here where we've actually got no bone around this tooth, it's disappeared. So it enables us to have a really thorough 3D radiograph examination so we know exactly what we're going to do in terms of planning your surgery.
Nothing is left to chance then?
Nothing is left to chance.
With me, Dr. Larry Benge. Larry, it seems to be the buzzword in dentistry these days. What exactly is All-on-4?
All-on-4, Stephen, is a technique which has been developed by Malo, where you can have a fixed set of teeth on 4 implants, either in the upper jaw, lower jaw, or both. It's a procedure that is actually simplified having fixed teeth because we only have one operation. We don't need any bone grafting. The implants are placed on day 1. You can have your new teeth tried in wax on the first or second day, and you can have your completed teeth in 2 to 3 days.
Is All-on-4 the only technique for fixed teeth?
It's not the only technique available. There are other techniques which historically are successful techniques, but they may involve bone grafting, bone taken from another part of the body or another part of the jaw and inserted into the areas where you don't have enough bone.
Obviously, cost comes into it.
And cost is very important, Stephen, because when you're going to have your teeth fixed, it's not cheap treatment. So if you're using 4 implants to fix a full set of teeth, it can be quite different compared to going through bone grafting, which is one operation, then waiting a period of 3 to 4 months before the bone grafting takes, and then going through a second operation. And often with bone grafting cases, you can end up with 6, 8 or 10 implants, which obviously puts the cost up significantly compared to the All-on-4. Everybody is different in what their requirements are, so a thorough examination both clinically and radiographically will determine what is going to be the best treatment for you.
Larry, let's get technical. What exactly is a zygoma implant?
Stephen, a zygoma implant is a titanium rod or implant that actually goes into the zygoma bone, which is this bone here on the arch or the cheekbone. The procedure involves placing the implant along the body of the jaw. Historically, they used to go in the sinus, not anymore. The technique means that we actually cut a little channel in the bone, but we don't perforate the sinus membrane. We then lock into this cheekbone. Now, these implants must be placed by a qualified oral and maxillofacial surgeon. Implants can be placed by dentists, they can be placed by periodontists, they can be placed by oral surgeons. These implants have to be placed by an oral and maxillofacial surgeon because we're dealing with the cheekbone, we're not dealing with the mouth.
The real advantage of these today is that instead of the implants starting in the roof of the mouth, where they were historically when they were developed 20 plus years ago, and that's when we started doing them, today they come out on the crest of the ridge out of the teeth. So you don't have an excess bulk on the inside of your teeth, which makes them more comfortable. Because Malo has developed this new technique for placing these, it means the procedure is far less invasive compared to what it was previously. He actually places them under local anaesthetic. Now, I wouldn't recommend that for everybody, and everybody's a little bit different. Some people want to have a general anaesthetic. Some people tolerate it under local anaesthetic. But the beauty of these implants are that I'm able to treat with the oral and maxillofacial surgeon patients that virtually have no bone left in the upper jaw because they've been wearing dentures for 30, 40 years. Now we can either use one implant on either side plus a single implant in the front, or we can use two of these. So you might end up with two of these and two small implants, or you may end up with four of these long implants. The beauty is that everybody is still able to be treated the same as the all-on-4 system, receiving their teeth in 2 to 3 days.
The Bond Street name is known throughout Australia. What prompted you to join forces with the Malo Clinic?
Stephen, I was really thrilled to be invited by Malo, who is the inventor of the all-on-4 system, to join his global network. It started in Lisbon, Portugal, and now is in 21 centres throughout the world and growing. It enabled me to visit Portugal on a regular basis, to be at the cutting edge of the new developments of the all-on-4 system, which really is an evolutionary thing. It's developing all the time. New implants are being designed. Malo actually designed the implant for this system. It has specific characteristics which make it really suitable for this system. It also enables me to be involved in the teaching of the procedure. So as a Malo clinic, we're responsible for a lot of teaching to other dentists to carry out this procedure. So I think what it's going to give for us, it's going for me and for my patients, is better technology, hopefully improved techniques all the time, and better outcomes.